is a little soapboxy. I know that. I'm going to get on my soapbox here. But it's something that it's got me, gets under my skin, okay? I want to talk to you a little bit about Medicare Advantage. I remember, investigating a few complaints where somebody felt like the facility had gypped them out of sufficient therapy services and they made a mistake. So whenever I'd go in, I'd usually find out they're on Medicare Advantage, and they just, cut services more abruptly. What I came to find out is that this Medicare Advantage, it wasn't like the usual traditional Medicare where, somebody, gets therapy and they plateau. That means they go to their highest level and they don't get any better, with therapy services. But with Medicare Advantage, it was like they have this algorithm that says if you're this age and this sex and these are your diagnoses, you're allowed to get X amount of therapy services. And I remember a therapist told me real clear, hey, consistently when they're on Medicare Advantage, it's fewer sessions and it's shorter sessions. And they do a few tricks. If you appeal the first time, they'll let you know right away. But when you appeal the second time, they'll do something like, they'll take 10 days to respond. So you're in a nursing home, you just had your Medicare Advantage say they weren't covered anymore, and you're like in a rehab situation where you're hoping to go home, but you really want more therapy, but you might get stuck with the 10-day bill, and that's a lot of a 10-day bill. It's not cheap. So most of the time people decide, oh, I don't want to risk it, and they leave. And that's the way the provider can say, hey, we might have allowed it. They just didn't stick around, right? But the problem I have with Medicare Advantage is just the way it's set up. It's like the insurance company, they get a fixed kind of amount based upon the diagnosis and the condition of the resident. And they make their profits, I don't know how to say this, but the less care they provide, the more profit they make, okay? So they're incentivized to do less, to provide less. And they're allowed to do things that are very suspect, like with traditional Medicare, usually you go on it, you stay on it, and that's that. With most of these Medicare Advantage plans, every year you have to decide, you're deciding and deciding. And, as you get older, as I said elsewhere, that risk of dementia increases and it gets harder and harder to decide, Why should you have to try to figure out something that's complex and changes every year, It's not an easy research. These aren't just like one-page statements. These go on and on. Gosh, this is a little hard here on that. Okay. Trying not to slip. And the problem is too, the guardrails that are in place, there's a lot of conflicts of interest in those guardrails. CMS oversees the regulations, right? But CMS gets its funding, its approval of funding from Congress. And Congress gets their funding, so to speak, from all these health insurance companies. They get all these campaign dollars, right, to win elections. And so that just might influence some senator when some peon inspector finds a practice that isn't so good and it costs the insurance company some money. You can be sure that CEO is calling the senator about the agency overstepping their boundaries, and then that senator is calling the head of CMS, telling them, hey, your people are overstepping their boundaries, and lo and behold, that person is taken off the investigation. Just saying. I've kind of seen it happen, or dynamics similar to that. Remember, I worked for the government 23 years. The other thing is, the head of CMS or other people at the top of CMS in high positions, they could immediately go work in the industry for making as much as they want, you know? So they have an incentive to be nice to these industries so that they can parachute into those right after working for government. I mean, it's like a sweetheart deal. Everybody makes some money, but I'm not sure that the seniors are really served properly for it. Gosh, I keep running into people here. A lot more people on the trail now. Geez. So I'm going to go down this little pathway here. Hopefully I won't keep running into people. I can talk. So I feel like, the guardrails, there aren't a lot of guardrails. There aren't, the incentives are giving business an incentive to do maybe exploitation or not provide the services that are needed. And, there's a lot of little tricky stuff that is done that I don't like. This whole idea of, giving like a payment to people that sign folks up, It's like we got this new cottage industry of Medicare consultants, How much do they ever really recommend traditional Medicare versus these Advantage plans? Because if you're an entity that signs somebody up on an Advantage plan, you get a little bit of a kickback for that. And even nursing homes are getting involved in that, where they're signing people up. And I think I mentioned before, some of these homes are even, requiring their staff to sign up so many people on Medicare Advantage, every month. And it's like, that can be all sorts of abuses with that if you're unethical enough. And it just upsets me because, people paid into this program since they're young. Not expecting, not questioning. I remember the first job I had, I saw it and I thought, okay, well, as long as I'm getting the care, fine. But my concern is, are people really getting the care when they're really vulnerable and needing it? And I don't think it's going to go away. I get that. I get it. There's people that, they have all these perks and the public is convinced, and you're not going to change that. And I'm not going to even try to change that. I just want you to be aware of what I'm saying and be cautious for yourself. In some cases, maybe you have no extra income whatsoever, and maybe that's the best you can do. It's not for me to judge. I just know that's been my experience. I forgot to tell you about that therapist who, as more and more people were going on Medicare Advantage in my state, he left. He said, I can't do this anymore. I don't feel like I can really hold my head up and provide the care I need to provide. He worked in a whole different field out of nursing homes because he felt that strongly about it. Because, you're a therapist, you want to see people get to their potential, and then you're told not to do it. It's frustrating for him. So he got out. So just word of caution, if you like your Advantage plan, just be aware of what I'm telling you. I don't have any incentive or motive. I'm just telling you what I've experienced and what I know. So take care of yourself. If you like what's said, thumbs up it and share it, and learn more at nursinghomerisks.com. Okay.